Naomi Moskowitz has just started riding a motorcycle.
I grew up on Long Island in an ultra-Orthodox Jewish community, pretty insular and with very clear and rigid gender roles.
The bike is just part of Moskowitz's journey in life that has taken her far from her beginnings.
I grew up only being allowed to wear skirts. I would have trouble wearing a skirt right now if you paid me.
Moskowitz and her partner are raising their 4 children in Nassau County, where they now have access to medical care at the Center for Transgender Care at Northwell Health in New Hyde Park, where she also serves on the center's client advisory board.
Figuring out how to get appropriate gender-affirming care is not so simple. For years I've been traveling into the city for it, and it's been really exciting and amazing to be able to access care on Long Island.
Moskowitz, who identifies as queer and gender fluid, admits life is not always easy becoming her own self.
I wanted to go out to celebrate Valentine's Day with my partner, and we asked our neighborhood, like, where's a good steakhouse? We didn't want to travel. And they picked, like a famous steakhouse on Long Island that we should go to. It was one of the most uncomfortable experiences for us. Just sitting at the table trying to order just a Valentine's dinner. But the way, everybody in the room was stuffy and judgy at us. And we were like, okay, next time we're just gonna head to the city for that.
Our goal is really to help people figure out where they are on their journey and help them figure out ways to be healthy and happy both now and in the future to take care of themselves.
Dr. David Rosenthal is medical director at Northwell Health's Center for Transgender Care that serves about 3,000 patients of all ages seeking to become their true gender identity.
I always say that you're transgender based on what's between your ears, not what's between your hips.
That transition can range from different clothes to a new haircut or undergoing surgical changes.
We have a gender-affirming surgeon. We have that does surgeries that both are top surgeries and bottom surgeries, as well as facial surgeries.
It's simultaneously the best time and the worst time to be trans in the United States of America.
Hannah Simpson, an advocate and activist who says she didn't change her gender changed her, transitioned a decade ago.
We're seeing so many states where parents are forced to make impossible choices about their livelihood and the future of their families, fleeing literal persecution.
Hundreds of pieces of legislation have been introduced across the country to make it tougher or even impossible for transgender youth to receive medical and mental health care.
When a younger child comes to see me, we basically say, let your child be a child, let them play with the toys they want to play with, let them wear the clothes that they want to wear, let them be happy, and make sure that you're supportive of your child and make sure that you can let them explore and figure out who they are.
At any age, a person's gender evolution can happen in part organically.
I met a friend who I hadn't seen in a while. He said to me, wow, Naomi, I didn't recognize you on the street. I thought you were just some guy. And I was just like, what? I don't look like a guy. And I looked at my reflection in the store window and I was like, huh. And I looked down and I realized I'm wearing men's pants and a men's shirt and men's shoes and my hair is short. And I feel great.
Out on the open road, Steve Langford for NewsdayTV.